to week 4 of I Spy with My MYO Eye. So far, we have talked about mouth breathing, pacifier usage, thumb sucking, transitioning off the bottle, and potentially skipping sippy cups or choosing an appropriate sippy cup. I'd like to think that we saved the best for last because today we're going to be talking about tethered oral tissues or tongue ties. And the reason for me that it's the best for last is tongue ties are what brought me into the field of myofunctional therapy. I'm very passionate about them, and I have a lot of personal experience with them too. My children, I have 2, were both born with tongue ties. Unfortunately, my first child was born when I was still working with adult population post-stroke and post-TBIs, so I wasn't doing a lot of assessment of frenums. I probably should have been, but I wasn't. So I missed it. But I switched to pediatric setting after a few years, and I was diagnosing a lot of tongue ties. I was finding a lot of tongue ties. I was taking a lot of continuing education courses on tongue ties, and I had realized that I missed it with my first. So when my second child was born, I was ready, and he was born, and it was great, but then he wouldn't latch. And I said, I think he has a tongue tie. And I heard all the things that I'm sure so many moms watching this video have heard. He's just a big baby. He'll get the hang of it. It's supposed to hurt. And that's not true. And I knew it wasn't true. So I went to an IBCLC after we were discharged from the hospital. And she said, I don't really know a lot about ties, but this looks really beautiful for a 2-day-old baby. But it didn't feel very beautiful. So fortunately for me, I knew a myofunctional therapist, my previous boss in Georgia, and I took him to her to be evaluated, and he had a tongue tie. She said, I really didn't want this to be the case for you, but yeah, he has a tie, and it is impacting his feeding. But there was peace there because I knew what I had to do. I knew the provider I wanted to go to, and by 2 weeks old, he had had his revision, and we had a beautiful, feeding relationship. He was able to meet the goal and go beyond that, so that was awesome. So that's why I am so invested in tongue ties. If you want to talk to me about tongue ties, I could talk all day long. But today what we're going to do is define what a tongue tie is. We are going to talk about the impacts of them on infants and children and adults, and then maybe some surgical or interventions that can be done to treat them. So let's talk about first, a tongue tie is your lingual frenum. So your lingual frenum is the tissue that attaches on the underside of your tongue to the floor of your mouth. I'm going to show you mine. So that little white string going right down the middle, that's my frenum. Mine always measures borderline tongue tie. It's functional. It can do everything it needs to do, and I don't have any negative implications from it. If I start to have some of those adult characteristics, I would get it revised. But as of yet, I'm still good. So a tongue tie or ankylglossia is a problem that's present at birth, and it can cause speech, feeding, dental, airway, all kinds of different issues. So let's first talk about what it could mean for infants. So the most obvious one is feeding, especially breastfeeding. You could have a persistent shallow latch. You could have clicking, chomping, grinding, tongue thrust, air swallowing, which can cause reflux and gas, inflammation, an oversupply for mom, arching of the back, poor stamina, which would result in short, frequent feedings or really long feedings where the baby's falling asleep at the breast a lot, cracked or blistered nipples for mom, low birth weight, or weight that declines after 12 weeks. And I think it's important to note why, because with my daughter, she was chunky. I didn't have any concerns about weight gain, but about that 12-week mark, my supply dipped and our weight gain slowed. And the reason this is milk is all about supply and demand. So the more we're nursing and we're draining the breast, the more milk that comes in. So if we're meeting our needs with that oversupply that comes right after birth, and we're not draining the breast, we're not telling our body to make more milk. And about 12 weeks, our body regulates to whatever the baby is typically taking. So we can see a drop in supply, which would mean a drop in our weight gain. Blisters on the lip, they always call it the breastfeeding blister right there on that top lip. That a lot of times will come from a restricted labial frenum where our lips are not flanged completely around the breast, which can definitely impact that. Spilling milk out of the sides of the mouth, and then even torticollis can be impacted by restricted lingual frenums or ankle glossia. So for children, so we've already gone through the infants. For children, they can have pickiness with textures, gagging, choking easily, chipmunking the food in their cheeks. They can aspirate, which is when the food enters into our lungs instead of going down into our esophagus. Articulation errors, messy eating. Our tongue is responsible for pushing the food to our molars to chew and keeping it kind of as a cohesive unit. And if we aren't doing that, that could be due to a tongue tie. Speech fatigue, difficulty initiating speaking, articulation errors. A lot of the times S, Z, sh, L, R are ones I see that are related to tongue ties. There's a lot of kids that don't have tongue ties that also have trouble with those sounds, but whenever I hear those as the list, I'm like, let's check that tongue. A high, narrow palate, teeth not fitting in your mouth, crooked molars also are all things that a tongue tie can impact in children. Now let's talk about, we've gone through the infants, we didn't catch it. We've gone through the childhood, we didn't catch it. Now you're an adult. These are some of the symptoms that you could be experiencing. Chronic tension, headaches, TMJ issues, facial strain, especially around the lips, sleep apnea, mouth breathing, which could be true for any age, infants, children, adults, and large tonsils, again, could be true for any age, and poor sinus drainage. So all of those symptoms can carry over. Adults can have the messy eating and difficulty with textures, but those are kind of specific to each age range of what we'd be looking for. So now we've talked about what tongue ties are, things that can happen because of tongue ties. Let's talk about what do we do. So everyone has a frenum. Everyone has that line underneath their tongue. The importance of it is, where is it attached? What functional implications does it have? So is it impacting my ability to speak clearly and be understood? Is it impacting my ability to eat and go out and enjoy food with friends and not feel self-conscious about messy eating or choking or aspirating? Is it impacting my ability to breathe through my nose because I have an open mouth posture? Is it impacting my ability for my tongue to rest in my palate like it should be, shaping my teeth and promoting my appropriate facial development? If there's a functional implication, then I typically recommend that the client go see a provider that has experience with tongue ties for them to do an additional assessment and determine if release is warranted. So then we get into the fun part of the different types of releases. There are so many different people you could go to. You could go to a pediatric dentist, a periodontist, you could go to an oral surgeon, you could go to an ENT, and I'm probably missing some off list. But you go to a lot of different people for a tongue tie, and I think the most important thing to consider is how much training have they done, what tool are they using, how much aftercare or follow-up are they going to do. So any number of professions can have a lot of training in the area and be very proficient at correcting a tongue tie. But a tongue tie also falls under the scope of a lot of different people, and maybe it could be somebody who does tongue ties every now and then and not all the time. My preference would be that when we're going for a revision, we're going to someone who has advanced training in tongue ties and making sure that we're getting the posterior component of a tongue tie to give the most functional benefit from the surgery. So I've found that a lot of dentists in the area have a lot of experience, and I'm building relationships with all different kinds of providers, happy to help guide the decision making. But there's lasers. A lot of times when we're doing a laser revision, it's an in-office procedure. We're not under general anesthesia, maybe some nitrous oxide for younger children and some numbing shots. That's what my son was revised with, the light scalpel laser. It was done in about 2 minutes and very minimal pain for him. He was not under nitrous oxide because he was so young. He was just numbed and gone from there. So I think it's great when you can avoid general anesthesia. And I've watched several 2-year-olds even go through it, and there's not much whimpering at all because these pediatric dentists are great. They have the TV screens up and they use the right language to keep the child calm and relaxed. There's all different types of lasers. There's scissors. Dr. Zaghi has a method that uses scissors to make sure you're getting the most function out of the release, where you're doing movements throughout. And there's the scalpel of cutting it too. So it all sounds very scary. I've witnessed all different kinds of providers doing all different kinds of releases or revisions. And it's just about picking what's the best fit for your family. So if you feel like you have a tongue tie, your child or infant has a tongue tie, and you are looking for support to go through that process, please feel free to reach out to us at Emerge. We have a team that is ready to help you. Thank you so much for joining us for I Spy with My MYO Eye.